Hello, my name is Dr. Ghee Kheng. I am a gynecological oncologist working in Penang Adventist Hospital. I have a special interest in management gynae cancer cases and also in helping prevent gynae cancer. So I have had about 20 years of experience looking after women with gynae cancers. I'm here today to talk to you about when to seek medical help. I think one of the most important things that we need to talk about is abnormal vaginal bleeding. Abnormal vaginal bleeding basically refers to bleeding when you're not meant to be bleeding. So between your periods, you shouldn't have any bleeding. If you've reached the menopause, you shouldn't have any bleeding. Abnormal vaginal bleeding refers to bleeding outside of the ordinary. So bleeding that you have when you're not having your period, bleeding when you have after intercourse, or bleeding after the menopause. Often people are confused as to when they have reached the menopause. So our textbook definition of menopause is when you've not had any periods for 12 months. However, this can sometimes vary, and also sometimes people continue to have bleeding, so they are completely uncertain when the menopause is. So I often tell patients that if you have a change in the pattern of your bleeding, so if you've been having regular periods and then suddenly your periods become a lot heavier or a lot more frequent, then it is very important to seek medical help. However, if you have stopped bleeding for 12 months and then you suddenly experience bleeding, it is important to seek help to see why you have this bleeding. So abnormal vaginal bleeding can come from the vulva, can come from the vagina or the cervix, and sometimes it comes from the uterus. In younger women, where the bleeding is abnormal, such that you're getting bleeding between periods or after sexual intercourse, we're often concerned about cervical cancer, so a problem in the cervix. So when you come and see a doctor, they will want to examine your cervix. If there is a growth on your cervix, we will then recommend taking a biopsy. We may also do a pap smear and often a HPV test. A biopsy will help us confirm if this abnormality on the cervix is a cancer. Sometimes we actually just see a polyp sticking out of the cervix, and this is usually benign. So it is quite nice to come and see a doctor for an abnormal bleeding only to find that it is not cancer. But basically, what we're keen to find out is if you have cervical cancer, we try and pick it up at an early stage so we can treat it and hopefully cure it. So abnormal vaginal bleeding can be caused by cervical cancer, and it can be caused by the endometrial cancer. Endometrial cancer is more common in the older women, usually women who present with abnormal bleeding near the menopause period or after menopause. So while some women may think that this bleeding is normal, if you come and see a doctor when you have a bleeding that you're not certain of, sometimes we may pick up that it is an endometrial cancer and we can treat it quite easily. When you have abnormal bleeding, what we're interested in is seeing why this has happened. So when you come and see a doctor in the hospital, what we do is we examine you. First of all, we take a history and try to ascertain the nature of the abnormal bleeding. So the nature of the abnormal bleeding that we're interested in is the heaviness in the flow, the frequency of the flow. And so you may sometimes feel that we are asking you a lot of unnecessary questions, but it has helped us try to work out exactly where the problem may be. What you may not think is important is sometimes quite important to us. So when we see you and after we've taken history, what we do is do an examination to work out where the bleeding is coming from. So abnormal vaginal bleeding can come from the vulva, which is the outside of the female organ. Then it can come from the cervix or the vagina, or it can also come from your uterus. So when we examine you, what we're interested in is seeing if the bleeding is coming from an abnormal lesion in the cervix or whether it's coming from your uterus. After the examination, we will do an ultrasound scan to see if there is a problem in the uterus. The way we pick up endometrial cancer is by doing an ultrasound scan where we look at your uterus and we look at the lining of your uterus. The lining of the uterus is thin after the menopause. So if you have a thickened lining, we will normally recommend doing a biopsy. Now the biopsy of the lining of the womb can be taken in the clinic or it can be done as a procedure under general anesthetic. This procedure is called hysteroscopy, which basically refers to putting a camera into the womb to take a biopsy. By taking a biopsy, we can confirm whether there is a problem which may be cancer, or it may be a pre-cancer, which means the cells have not turned into cancer yet. Both of which can be treated quite easily if we pick up the problem. Cervical cancer can be prevented by through screening and through immunization. So by cervical screening, we are talking about taking cells from the cervix or doing a HPV test. The long-standing test that we have had for a long time, since 1940s, is the pap smear, which is when we collect some cells from the cervix to examine the cells. The pap smear has been around for a long time but has some errors associated with the investigation. So these days we have a newer, more accurate test called HPV testing. HPV stands for human papillomavirus, which is a virus infection that is quite common. So in order to get cervical cancer, you need to have an infection with HPV or exposure to HPV. So by doing the test, we are testing to see if you've been exposed to HPV and whether the infection is persistent. So if you do not have the HPV infection, we know that the risk to get cervical cancer is actually quite low. But if you have the HPV infection, it alerts us that you may be at risk of developing the cancer, which then allows us to do a pap smear to collect the cells to see whether the infection has caused a change in the cells to develop into cancer. So we recommend HPV testing at least every 3 to 5 years to make sure that there is no ongoing infection or that there is no new infection. The other way to prevent cervical cancer is through immunization. We now have HPV vaccine, which has been available in this country since 2010. HPV immunization allows you to be vaccinated against 9 types of HPV virus that can cause the cancer. In total, we have recognized 14 HPV subtypes that can cause the cancer. By vaccinating yourself against these 9 subtypes, you are protecting yourself against 90% of the cervical cancer caused by HPV. This vaccine can be given at any time, but preferably it should be given before you're exposed to any sexual activity. HPV vaccination is a very effective way to prevent cervical cancer. School children are actually recommended to have vaccination at school at present. However, the vaccination is available to anybody who wishes to have this. Although the vaccination was targeted at girls, it is now recommended that both females and males get this vaccination because it will help prevent cervical cancer. It will also help prevent other HPV-related cancers.